I spent 6 years in the Assembly from 2006 to 2012, much of that under the Schwarzenegger administration, so I could spend an hour on a panel just giving you the stories of the Schwarzenegger administration. I do want to thank certainly the Senator and Assembly member for putting this on, and for everybody coming out here to our offices on a Saturday morning. Molina is truly an American success story. We were founded in the early 80s by an ER physician out of Long Beach who saw too many people coming into the emergency room for their primary care. And so he recognized the need and opened up kind of the first urgent care brick and mortar clinic that we see today in Wilmington. And he hired people from Wilmington, people who knew the community, knew the needs, knew the health needs, spoke the language, all of those things to ensure that those folks were getting their health care, but not having to go to the emergency room for that, your day-to-day coverage. And it's amazing to see how just one idea grew from there to fast forward 30 plus years. We are the largest Hispanic-owned company in the nation. We're a Fortune 200 company. We have over 20,000 employees across the country. We serve over 4 million members throughout the country, and it's something that started with a true passion and a true mission that has led to where the company is today. A company that is focused purely on improving the lives of our members, and that is something that I think if you talk to any of the Molina employees here today, they'll tell you that was a big part of why they chose to come to work for Molina, is because of the mission and the leadership that is set by the Molina is different than what many of you would think of as a healthcare company, from the Blue Crosses, the Anthems, the United, the big commercial insurers. Molina is overwhelmingly focuses on government programs. So Medi-Cal, here we're one of the Medi-Cal providers in California, and that is where a majority of our members come from. We contract with various states to be one of the Medicaid providers, and so certainly serving those who haven't had coverage before, those who need coverage, falls right into kind of the wheelhouse of what Molina does. As a result of the Affordable Care Act, we did decide to participate in the marketplace or the exchanges, so to begin to do a little bit of the commercial side. Because what you found is, and I know many of you are aware of this, that many people that are on Medi-Cal have inconsistent incomes. So there will be times when they are eligible for Medi-Cal, and times when their income spikes seasonally and they are not eligible for Medi-Cal. And so we felt by having a product on the exchange would allow those members of Molina to say, okay, we've got to go find a commercial insurer. Oh, great, Molina is one of our options. So you can keep that continuity of care instead of saying, well, for 6 months I'm going to be with Molina while I'm on Medi-Cal, but now I've got to go on this, I'm going to go to United, but then I've got to go back again to, and it just becomes something that people aren't going to do. So having that that small piece in the marketplace is something that that we have decided to do. And while other companies have continued to lead the marketplace across the country, Molina continues to serve and to be part of that. And we are, like many others, we are threatened by what is happening in Congress. Not just the big concerns that we would have with either the Senate or the House version is the cuts to Medicaid, and even the block granting or the per member program. Any way you spin it, people will lose coverage, and as much as you want to. And I know that they'll say, well, that's because some people will then go back on through their employer, or they'll do others. But the bottom line is, there are those who will no longer be insured, if either program gets passed. And so we have major concerns, obviously, about that. Also about the cost sharing component on the exchange. That's been a big program that if it is not fixed by Congress, that could force a company like Molina to then leave the exchange, because we then just could not afford it anymore if those cost sharing payments are not continued. So obviously, I think next week is a big week in Congress. The Senate's going to vote just to see whether they're going to take it up. So we don't even have that in the California State Senate, where you got to vote to decide if you're even going to take up an issue.
We kind of do it informally in caucus.
That's right, sure. So that's the first question, right, is next week they're going to have kind of the first test to see if they'll even have the votes to take it up. And so I think we're watching that very closely, as are all of you, and we are working very hard to see if there are going to be changes that, the cuts to Medicaid need to be minimized as much as they can, because again, for us, that is, those are our members, and that's where we will see Molina members no longer be able to afford coverage. And also it puts other pressures on the states, because then the states are forced to choose, okay, if our federal component is going to be decreased and we want to maintain that same level, we have to find funding from another source. And where is that source going to come from? And in California, it becomes even more difficult, because so much of the California budget is already locked up constitutionally. You think of Prop 98, where 40% of the state budget goes to public education per the Constitution. That's it. So it makes it very difficult here in California for our state representatives to find unallocated dollars, to provide that backfill of coverage. And even if they did, it's still a pretty big chunk. I mean, California's in a pretty good position, financially, compared to other states where they are in deficits, and there is no other money to backfill those resources if the federal dollars get cut. So there's a lot of things that we're watching, because each state impacts us differently as well. But I can tell you, it's really great to work for a company like Molina that has a true mission. And it's a mission, beyond the bottom line, beyond the dollar. It's certainly, we need to stay in business. So thank you very much for coming out, and look forward to taking as many questions as we can and having a great dialogue.